While some find it pure heaven, and for others eating spicy food is a form of torture, either way, whether you crave the heat or not, it's a personal preference. To understand what makes food spicy, we need to take a look at a group of chemicals called vanilloids. Vanilloids are compounds containing a vanillyl group, which is a benzene ring with a hydroxyl or OH group on the first carbon, a methoxy or OCH3 group on the second carbon, and a CH2 attached to the fourth carbon with a variable R group. To detect these chemicals, the mouth contains VR1 vanilloid receptors, which are involved in the detection of harmful chemical and physical stimuli. These are found in the mouth, tongue, and skin as part of the nociceptive neurons in the peripheral nervous system. On stimulation, the nociceptors open to allow cations to run through and produce a signal that travels through the nerves and spinal cord to the brain, resulting in the perception of pain. The primary nerve that communicates spiciness is the trigeminal nerve, which branches out from the brain to the mouth, nose, and eyes. There are 4 ways VR1 receptors can be activated exogenously, or in other words, from external stimuli. These are hot foods over 43 degrees C, acidic or low pHs, capsaicin, and allyl isothiocyanate, which is the pungent chemical found in mustard, horseradish, and wasabi. The reason why we have these receptors is that these things would generally cause damage to the sensitive surrounding tissue. Capsaicin, the active component in chilies, also binds to these VR1 receptors, causing the sensory neuron to depolarize and send a signal indicating the presence of hot or spicy food. Exposure to capsaicin results typically in inflammation, though this is mostly due to nerve excitement as the chemical itself does not cause tissue damage or chemical burns. This stimulation also increases the heart rate to boost metabolism, while at the same time releasing sweat and endorphins around the body, causing the nose to inflame and the eyes to water. VR1 receptors prevent us from consuming these substances by triggering nociception, the nervous system's response to potentially harmful chemical, mechanical, and thermal stimuli. Because these receptors detect heat and spiciness equally, spicy food tastes hot even at room temperature, and the opposite is seen when consuming cooling foods like menthol. The sensitivity of TR1 receptors to noxious stimuli can change, for example, during inflammation, when inflammatory markers like prostaglandins and bradykinin are released and increased nociceptor sensitivity. So, where exactly is capsaicin found? Capsaicin is located in the seed-containing placental tissue of capsicums, as well as in small amounts in the flesh. The seeds themselves do not produce capsaicin, though the inner wall where they are attached contains the highest concentration of the chemical in the entire fruit. In birds, TR1 receptors do not respond to capsaicin, allowing seeds to disperse and germinate having passed through the digestive tract. Capsaicin is hardly a useless chemical, as apart from stimulating pain, it has many other uses in the food, security, and pharmaceutical industries. It is predominantly used to add spice to food, and recent studies suggest that the level of spiciness most desired by people is that which is only just below their threshold. Why this is the case is unknown, though similar studies indicate that people who favour higher levels of spiciness are also more likely to take part in other daredevil activities. It is also widely used medically for 3 reasons. Capsaicin has antifungal properties and is commonly used to relieve pain topically in dermal patches in low concentrations, and aches in muscles and joints as a cream. It does this by reducing substance P, a pain transmitter that is found in large concentrations in the medulla in the brainstem. It can also be used to relieve symptoms of peripheral neuropathy, which refers to any disease affecting the nerves outside of the central nervous system, the brain and the spinal cord. More controversially, capsaicin is a crucial constituent in pepper spray and is frequently used for deterring pests, due to the pain induced when it comes into contact with mucous membranes in the lungs or the eyes, and irritation to skin. In terms of the treatment to capsaicin, there are many things that you can do to reduce the spicy effect of the chemical, although some don't seem very intuitive. The first step is to remove the source, whether it's in the form of chilies, peppers, or spray. The next thing to do is to bathe the affected membrane surfaces in oily compounds, which works as both oil and capsaicin are hydrophobic hydrocarbons, meaning it can dissolve and quickly leave the body. Water, bleach, and antacids are ineffective, even though the instinctive reaction to the heat is reaching for cold water. Capsaicin is also soluble in alcohol, which may be used to clean contaminated surfaces. Milk is also effective, as it is primarily composed of the protein casein, which acts as a detergent. Despite the common conception, tolerance to spicy food is usually short-lasting, as your nociceptors hide themselves to reduce damage. If you do have long-term tolerance, this is generally due to excessive damage to these receptors. In reality, if you can't handle the heat, then the likelihood is that isn't going to change.